just know that there are so many different things that we could be covering here. There's absolutely no way to cover all the professional growth and possible certifications in a single slide. I hope I don't offend anyone by leaving certain certifications off or talking about things in a certain way. I'm going to give my own personal biases on how I see growth and opportunities at each level. But for every single example I give you, I guarantee you will be able to find a counterpoint somewhere. It just drives home the point of how much opportunity and freedom there is in the lab space when it comes to defining your own career path, your own professional growth, and the opportunities that are present in the near and distant future for you. So starting out, just looking at this in general, the most obvious way to break down career development is looking at your degree. Going from an associate to a bachelor's to a master's degree, a doctorate, passing one of the many different boards to potentially become a laboratory director. At every single level, you add new skills, you add new potential responsibilities, and completely new career tracks, possibly. So we're going to start out. There's absolutely no reason that you have to progress in your career from the left of this page to the right. There's no inherent benefit by adding more degrees. If you are completely happy with what you're doing, with your associate's degree, if it's fulfilling your needs and your roles, then continue doing that. That is absolutely what you should be doing. We are working to enjoy our lives. We're not working to gain more letters behind our name. But if we're just looking at opportunities or things to consider for growth, so you start out, say you have an associate's degree. In general, if I was going to generalize, it tends to be more routine testing. You don't have as much responsibility. You can always think about a certification like becoming an MLT. An MLT is a specific certification that shows that you've had certain lab training, and it can help open up certain doors. If you do want to go from an associate's degree to a bachelor's, there are, you could take night classes, you could take a year off. There are ways to further that, depending on your current situation. It can open the door to more complex tests, added responsibility, some limited laboratory management, some leadership potential. And I say some, I probably shouldn't emphasize the some so much, because you can become certified as a med tech. And honestly, from my own personal biases, a med tech with large hospital experience is worth their weight in gold. The skills that they've developed, the benefit that they can provide the laboratory, that is the exact type of employee that I'm looking for a lot of different roles. And I tend to jump at that certification. But there are a lot of other things that you can do. There are a lot of ways you can be successful. But personally, a med tech with big hospital experience just looks great to me on paper. If you want to go from a bachelor's to a master's degree, there are, in my mind, 3 different tracks that you could go down. You can get a basic science master's, which is one of my degrees. I made me near and dear to my heart. It can open up certain areas of testing. You can get certain specialty certifications. This is where, if you're really into histology, you can become a histotech normally at the master's level. This is a good way to set yourself apart and break out. This will definitely get you more into the management administrative side if you are interested in that. There's also like a master's of health administration or an MBA. Very different roles. And again, generalizing here, but with an MHA, you tend to go more towards, you're going to be more patient focused or clinically focused. You're going to be doing things involving the operation itself. But again, it's going to be more clinically or patient focused. In general, if you get an MBA, you can still be working for the healthcare administration, but you tend to be more public focused or payer focused. It's not, you're both MHA and MBA tend to take a big step away from the laboratory and the bench. But the MHA, although you're not at the bench, you can still be very involved in the laboratory, whereas the MBA, you tend to be further away. However, again, I got to throw out my own exceptions here, because I know plenty of MBAs that are lab owners that become lab directors. The MBAs who are, MBA, PhD lab directors, they are great because they can develop the business. I mean, they have skills that normal laboratory directors don't. So there are lots of different ways that you can grow, especially at this level. Once you get up to the doctorate level, this is going to be several years of additional school, regardless of the route that you end up choosing. I went the PhD route. I did a research doctorate, and then on top of that, I did a postdoctoral fellowship in clinical chemistry. MDs, DOs, podiatrists, DCLS, whatever the degree is, they tend to not, aside from DCLS, you tend to not come out of school with a large amount of clinical experience. Even though you know the laboratory inside and out, you know the research laboratory, at least with my program. I didn't know the clinical side. The postdoctoral fellowships are great. This is where you can really specialize into whatever really interests you. I liked clinical chemistry from American Board of Clinical Chemistry. For me personally, it's just great general education. But if you're interested in transplant medicine, you could become an HLA lab director, which is interesting and critical. It sometimes makes it difficult because you're on call essentially all the time. You never know when you're going to come out to have to go in and type an organ. But it's a great profession and it's very interesting. You could do blood bank, molecular genetics, tox, forensics specifically, which involves a lot of tox, but has a lot more than just toxicology. There are even fellowship programs in bioinformatics and big data. I mean, we produce so much data in the laboratory. Having good laboratory focused people who can apply their laboratory background to informatics can be very useful. If you want to be a laboratory director, that's when you need to throw in specific credentialing. So again, I went with ABCC. There's also ABB is great, NRCC, specifically ASCP for genetics. ASCP tends to be more master's level certifications for the bachelor's level, but they are great in genetics. They have some really good genetic training that occurs. APB, ASHI, if you're going to be doing HLA or transplants. It's a long road, and so there's never a time you're never too old to try it. I mean, I was non-traditional. I definitely started into graduate school later. And you're never too young to start considering this. So just because you are, it's your first year out of college and you're working at your first med tech job, that doesn't mean to say that you shouldn't be thinking about, well, what could be the next step? The next step might be 10 or 15 years down the road, but you'll start laying the groundwork for it. Trust in the people, trust in the management of your laboratory. I take a lot of pride in professional development, and I love seeing where my technicians end up going. I like when they get hired for jobs, when they become lab directors themselves. It gives me a lot of pride, and I feel good about that. So give your administrators the opportunity to mentor you. Tell them what your goals are. Say, I would love to be doing X in 2, 3, 4 years. Even if it is very clear that means they're going to be leaving the position, a good lab director, a good manager will support that, try and build them in. And honestly, I greatly appreciate it when somebody comes and tells me, hey, my 2-year plan is to be working at another job in 2 years. I want to be doing this. I want to get my master's degree and go work for a big healthcare organization. The great thing about that is that now I can plan for it. I know that I have 2 years with this person where I can benefit them, but at the same time, I also have people under them where I can start building them up so that the transition isn't as rough. And there's nothing better for me as a laboratory director than to interview a possible new employee who is sitting at their current job. If they're sitting at their current lab and interviewing there, that means they've talked to the laboratory. They have a good relationship with them. The laboratory supports them moving on. That says good things about the laboratory. It says good things about the employee. And that, I think, is beneficial all around.